Welcome to Wellness IQ by sbmemorial.com. The thyroid is a small, butterfly-shaped gland in your neck. It produces hormones that regulate metabolism. Sometimes the thyroid gland can develop problems, requiring medical attention. In some cases, surgery may be the best course of action. Several conditions can lead to the need for thyroid surgery. An overactive thyroid, known as hyperthyroidism, can cause a range of symptoms like weight loss and rapid heartbeat. Conversely, an underactive thyroid, called hypothyroidism, can lead to fatigue and weight gain. Thyroid nodules or lumps are another common reason for surgery. While most nodules are benign, some may be cancerous and require removal. Enlarged thyroid glands, also known as goiters, can also press on the trachea or esophagus, making surgery necessary. Thyroid surgery is a common procedure, and with proper care, most patients recover well. Understanding the reasons for surgery and what to expect can help alleviate anxiety and ensure a smoother recovery. Before your surgery, your doctor will give you specific instructions to prepare. You'll likely have blood tests, imaging scans, and a physical exam. These assessments help your medical team understand your overall health and tailor the surgery to your needs. Your doctor will advise you on medications to stop or adjust before the procedure. For example, you'll need to stop taking aspirin or blood thinners to minimize bleeding risks. It's essential to follow these instructions carefully to ensure a safe and successful surgery. Quitting smoking is crucial in the weeks leading up to surgery. Smoking interferes with wound healing and increases the risk of complications. Your doctor can provide resources and support to help you quit. Preparing your home for recovery is also important. Stock up on easy-to-prepare meals, comfortable pillows, and anything else that might make your recovery more comfortable. Thyroid surgery is usually performed under general anesthesia, meaning you'll be asleep during the procedure. The surgery typically takes a few hours, depending on the complexity of your case. The surgeon will make a small incision in the front of your neck, providing access to the thyroid gland. The extent of surgery depends on the specific condition being treated. For example, a partial thyroidectomy removes only part of the gland, while a total thyroidectomy removes the entire thyroid. In recent years, minimally invasive techniques like robotic thyroid surgery have become increasingly popular. Robotic surgery uses smaller incisions and specialized instruments, potentially leading to less pain, scarring, and faster recovery times. After the surgery, you'll be monitored in a recovery room for a few hours. Most patients can go home the same day or the next day. Your medical team will provide specific instructions on wound care, pain management, and follow-up appointments. Recovery from thyroid surgery is usually smooth, but it's crucial to follow your doctor's instructions carefully. You'll likely experience some pain and discomfort in your neck, which can be managed with pain relievers. Keeping the incision site clean and dry is essential to prevent infection. Your doctor will provide specific instructions on how to care for the wound. Avoid strenuous activities and heavy lifting for several weeks after surgery. Depending on the extent of your surgery, you may need to take thyroid hormone replacement medication for life. This medication replaces the hormones your thyroid would normally produce. Regular blood tests will help your doctor adjust the dosage as needed. Most patients can return to their normal activities within a few weeks. However, it's essential to listen to your body and gradually increase your activity level. If you experience any unusual symptoms, contact your doctor immediately. While most thyroid nodules are benign, some can be cancerous. Thyroid cancer is relatively uncommon but highly treatable, especially when detected early. Surgery to remove the thyroid gland is the primary treatment for thyroid cancer. Following surgery, you may require additional treatments like radioactive iodine therapy or hormone therapy. These treatments help destroy any remaining cancer cells and reduce the risk of recurrence. Regular follow-up appointments with your doctor are crucial after thyroid cancer treatment. These appointments allow your doctor to monitor your recovery, check for signs of recurrence, and adjust your treatment plan as needed. For all health-related queries, visit sbmemorial.com.